Obama has often said that eliminating waste and inefficiency in the healthcare system could pay for most of any healthcare reform package. Critics have howled that there could not possibly be that much waste. And in our fourth story in the countdown, a remarkable independent study not only supports Obama, but proves he may have vastly underestimated just how much waste there is. The U.S. healthcare system wastes at least $505 billion, perhaps $850 billion every year. This is according to an independent study by Thomson Reuters, the international news and information organization with expertise in healthcare and science. The vice president of healthcare analysis for that group saying, quote, "That's 1/3 of the nation's healthcare bill. The good news is that by attacking waste, we can reduce healthcare costs without adversely affecting the quality of care or access to care." Other findings from the study, 37% of waste, 200 to 300 billion a year, comes from unnecessary care, like the overuse of antibiotics or lab tests to protect, in part, against malpractice exposure. 22% of healthcare waste, up to $200 billion, is created by fraud. 18% of it comes from administrative inefficiency and redundant paperwork. 11% of waste derives from medical mistakes, and preventable conditions such as uncontrolled diabetes cost $30 to $50 billion a year by themselves. That's about 6 to 10% of healthcare waste. All this explaining why the U.S. spends far more per person on healthcare than any other industrialized nation. For example, the average U.S. hospital spends a quarter of its budget, on billing and administration, and that's about twice as much as Canadian hospitals do. Let's turn to the executive director of the California Nurses Association and the National Nurses Organizing Committee, Roseanne DeMoro. Thanks for your time tonight.
Hi, Keith. Thank you for having me on.
So that's how much we're wasting. How much can we realistically stop wasting and feed back into paying for reform?
Well, hopefully we could, cut that figure by 80% or so. The biggest perpetrator of fraud is the system we have. It's the market-based healthcare system that you talk about continuously. The fraud is in, the insurers basically taking an illegitimate cut. They're a fraud in this system, and it's something that's not being discussed. Their role. Ultimately, what are we paying for when we're paying for insurance? Basically a middleman. We like to say that even, they take 30% off the top of every one of our dollars. This is our hard-earned dollars. Even the mafia doesn't take that much off the top.
Yeah, Vegas is limited legally to an 18% profit
It's
per dollar.
outrageous.
But one figure out of this study really jumps out, that 37% of waste comes from unnecessary treatment. This is listed as, well, this is the explanation for avoiding medical malpractice, but it's not just that. Doctors I've talked to say they often go for tests that they don't really need because it's a way of getting people in and out of their office faster, and one of the few ways they have of increasing their revenues is to see more patients. And if you have instead a half-an-hour conversation or a test that is done somewhere else, or a preliminary antibiotic that is done somewhere else, that saves them half an hour and doubles their, the people who use the turnstile. It's not just a question of tort reform here, correct?
Well, look, let's talk, what is tort reform? That's basically red meat for the right wing to say that people shouldn't have the right to sue when something harms a patient. And so the lawyers are vilified, while in fact scamming the system by providers and insurers are why there's fraud. There's so much. It's just outrageous. Part of what you talked about, part of this study, is the fact that Medicare fraud, right? Well, what is that? That's insurers and providers scamming the system with all of to basically make more money. There's so many profit centers in this industry. The insurance industry made, you're talking about fraud of $80 billion. The pharmaceutical industry made $77 billion in profit last year. $77 billion. Ultimately, I look at individuals, and the nurses every day, every shift, every hour, look at the patients in their hospitals, those who didn't get the care that they need. 45 million uninsured. That's fraud. 44,000 people who die every year from lack of care. That's fraud. How we define this, and we really wish the Obama administration would actually step up to the plate. The problem here is the money in politics. This industry, healthcare, is the #1 spender in lobbying. Ultimately, if you want a good job, go to work for the healthcare industry and lobbying on the Hill, because that's where That's where this begins and ends. And so we appreciate your show because you're always looking for the solution. If we could take our copays, our premiums, all of that, and just buy our own politicians, because that's what it is. We're paying for it.
Yep.
We're paying for it. We're paying it through our premiums. And then our studies have showed that almost 1 out of every 5, or over 1 out of every 5 patients is denied care. So we're paying these premiums, we're denied care, then they're taking our premium dollars, not giving us the care, and then pocketing, sending it to Washington, D.C. to buy off our politicians. And, you know, every politician in that building, every politician in Congress knows the solution. Medicare for all, right? Obviously, the most efficient, the most cost-effective, the highest quality. But that's not where they want to go. They want to vilify the public option. Well, it's the private option that we have the problem with. The nurses have a problem with the private option because every day and every shift, patients are dying unnecessarily.
And when you mentioned fraud, of course, there's the fraud of every canceled policy and every suddenly established pre-existing condition. Roseanne DeMoro, the Executive Director of the California Nurses Association.
Thank you, Keith.
Great thanks to you.